Hi, this is Dr. Vatiri, and again we're back. Still working on our healthy spine and a properly functioning nervous system segment of our Genesis Life Wellness Program. If you remember how we left off our last segment, we were speaking about how by having a properly balanced and properly moving spinal system where your spinal column is properly aligned and all the movement, the range of motion is correct, it will afford the ability to protect the very sensitive and delicate nerves that come out from the spinal cord and eventually to every single part of the body. We also made a very strong point and a strong argument to say that if we have proper connection from brain to body, your body will have the best ability, or the organs and glands and muscles will have its best opportunity to function at their maximum potential, or their optimal ability, which then translates into being healthy. We also mentioned that some other outside factors like diet, exercise, stress, drinking water, supplementation, breathing exercises, these outside factors play a role on your overall wellness because they can directly affect various organs and glands. But nonetheless, the factor that transcends the outside factors is that inside factor, making sure that there's a proper connection from the brain to the body or the organs and muscles and glands via the nerves. Now, what happens if there is some type of insult or some type of stress that's placed on your spine? Something that's caused from an external force that's placed on the spine that can either immediately and or over a long period of time cause an imbalance in either the position or movement of the spine. So let's take this for example. Okay, when you're in your mother's womb, you're somewhat protected, and there is not as much physical trauma on your developing spinal column, as long as there's no direct trauma to the mother. But now it's time for this baby to be born. Now you're being born, and here's the instance. Okay, in a normal delivery where you're going through the uterus and through the vaginal canal and being birthed in the normal way or the non-surgical way, what happens is the head begins to crown, and there's a tremendous amount of pressure now as the head is crowning through the cervix, and the pressure from the contractions are tremendous on not only the skull but on the spinal column as it begins to be forced through the canal. As the head begins to crown further and begins to dislodge from the cervix, usually the obstetrician now takes the head, maneuvers it, turns it in a direction to allow one of the shoulders to be lifted out, and then there's a significant amount of force that is afforded on the base of the skull to sort of dislodge or pull the baby from the mother's womb. There's some statistics or some researches that say it's anywhere between 60 to 90 pounds of pressure that is applied to that area of the spine as the baby is delivered. Now the argument is this, is that if that amount of pressure is put on the spine, there's a very good chance that some of the ligaments and some of the supporting structure that is holding the spinal column in its proper position and balance, even at that early age, can be rendered somewhat damaged, where it can cause a laxity or a stretching of the ligaments that then over a period of time can develop into a pattern of imbalance in the spine. Okay, now we may not think of it in just a newborn, but if you think about the amount of trauma that's afforded in that process, you have to appreciate that there could be a significant amount of trauma on that area of the spine. Not to mention if somebody is born through a cesarean section, the abdominal area is opened up, the uterus is opened up, and then the baby is then dislodged out, usually with forceps or some type of force, where the baby can be delivered in a way that some force is put into the spine area. Nonetheless, if you are able to survive without any trauma in the birth process, then you have to be brought home, and you're carried around by family members. And the thing that we always say when we're handing a baby off to somebody to hold a baby, we say, "Oh, please watch the head." And it's not so much the head we're watching; it's that everybody has this understanding, and it's global knowledge, that the head of a newborn is almost 1/3 the weight of the entire body of the newborn. Okay, it's much larger, and the musculature in the spinal column of the baby is basically non-existent, because there was no need to have strengthening. There was no way that cervical spine or any of the spinal muscles were developed inside the mother's womb. So we're taught to hold the baby in such a way that we're supporting the neck and the head as not to make it drop because of the weight of the head. Needless to say, it is a very sensitive area, and if there's some slip-ups here and there, or wherever the situation may be in the mishandling of a child, we can afford some insult to be put into that spine, especially the upper cervical part of the spine. Okay. Now, as the person develops, the first part of the spinal column that is developed as far as the muscular is concerned is the neck area. And we see that babies are either lying on their back or lying on their stomach, and they may wiggle their arms and legs around, but they'll begin to be, to learn how to turn their head from right to left. And if you lie a young infant on their belly, they will always attempt to try to lift their head up. And that is the beginning of the development of the muscles of the cervical spine. Now, as a side note, just to understand the mechanism of the spine, or the position of the spine, is that the spine in an adult eventually has 3 smooth curves to the spine, and they're called lordotic curves and kyphotic curves. The lordotic curves are in the neck and the lower back, and those are C-shaped curves that go from the back of the head, so from the skull, towards the front of the body, and then curves back towards the mid-spine. And the mid-spine, or the thoracic spine, has a kyphotic curve, or the spine that arches backwards, going down towards your lower spine. And then your lower spine arches inwards, okay, causing a curve in the lower spine. Now, that's natural and normal to have somewhat of a curve. And they're all developmental curves, okay, because human beings are bipeds. We stand on our feet, and from the early age we're learning how to lift our head up, and that develops the first curve in the neck of our cervical lordotic curve in our neck. And then as we begin to stand up, either in the crib or the playpen, or in children maybe at a year of age, they become weight-bearing. They'll start to develop that lumbar curve, or the lordosis in the lumbar spine. Now, this is natural. This is what's supposed to happen. But over time, as the curves are developing, there are still insults that can happen to the spine. So, for the example, even a baby that is, I remember my kids at 4 and 5 months of age, they're trying to stand up in the playpen or in the crib, and then they let go and they fall down on their rear end. Now, that continuous insult at 4, 5, 6, 7 months period of time before they learn how to walk, okay, can be quite traumatic on their spine in general. Now, think about this, for instance. I remember my oldest daughter, she actually started walking at 8 months old. She just was crawling around. Matter of fact, we were at a convention, and she was crawling around with a couple of other kids, and crawled up to a chair and climbed herself, to lean on a chair, and just started walking, maybe about 10 to 15 steps at 8 months old, which was kind of young. It was maybe a little bit premature to do that. Now, she might have had the balance, but the spinal balance or structure was not developed yet. And like every other child, she walked for X amount of steps and then bang, fell right down. And most of the time they're falling right down on their buttocks, and there's a tremendous amount of axial force that's put through the spine. Now, if you think about it from us as adults, if you just decided to just fall down, just fall back and land on your rear end, you would definitely cause a tremendous amount of damage, not only to where you land and hit, but the whiplash that would go through your spine could be devastating at least. It would definitely cause some type of trauma either to the disc or maybe even fracture some area of the spine. And as people get older and the bone begins to lose its internal network or meshwork due to our calcium depletion, especially in women that are postmenopausal, there's a very, very good opportunity and possibility that the vertebrae would actually compress and fracture. The point, though, that we're trying to make is that just in the normal development of the spine, there is a tremendous opportunity to develop abnormal positions and balances in the spine. Needless to say is that in the course of our daily living, from the time we're very young to the time we're sitting here in my room, we're having this conversation, I would probably think you slipped and fell several dozen, if not hundreds of times in your lifetime. Fell off your bicycle. If you played sports, men or woman playing sports, multiple traumas, not only to the spine but other areas of the body. Lifting up heavy objects, women being pregnant and then not pregnant, and then pregnant and then not pregnant, changes the weight bearing and the position of the spine. Talking on the telephone, working on computers, sleeping on a bed that's sort of uneven or having poor posture. There's a number of opportunities, from slips, falls, car accidents, work accidents, just habitual things that we do that can cause positional insults and misalignments and trauma to the spine. Now, some of these traumas are acute traumas. They're in the accident mode. They slipped, the fall, a file cabinet fell on top of you. And then some of them are just positional problems. Like I said, talking on the phone, or your work position, or the chair you sit on at home to watch TV, can slowly, over a long period of time, develop a subacute or a slow situation where the spine is losing its normal balance, and we develop a pattern of misalignment where the vertebrae and the supporting structure around it, meaning the ligaments, the disc, the capsule of the joints that are surrounding the posterior joints of the spine, will either lose their position or increase their size of the joint because of maybe some swelling, or the disc begins to bulge out. Nonetheless, the opening of where the nerve comes through between the vertebrae, if that opening becomes compromised, again, either because of swelling, a disc being out of place, or pure misalignment of the vertebrae, that abnormal position and movement can cause pressure on top of that nerve. The pressure on top of the nerve and the complex of the situation of the spine being out of its normal position in a specific area is called a vertebral subluxation complex. Now, since we all lived in a planet that is governed by gravity, and that there's no escape from it, and there's no escape from physical trauma that affects us, our spine and our skeletal structure, we cannot escape this. It is a probability that if you live on the planet, you will have a subluxation in your spine. Now, some subluxations are more pronounced than others, that they may cause a significant amount of pain. I mean, it is a common understanding that 80% of the population of human beings will suffer from lower back pain at any given point in their life. They would have some history of lower back pain, and the rest of the folks out there may be suffering from neck pain or mid spine pain. But it's almost 100% of the population that will have some imbalance in your spine that would cause some type of pain. Now, the problem, again, is not the pain. The problem is the imbalance due to the abnormal position and movement of the vertebrae. Now, you can look at, if you're a mom or a dad, you can look at the spine of your children, just have them stand there, and you'll notice maybe one shoulder is higher or lower than the other, and then you may look at one hip higher than lower, or their shoulder blade may be more posterior than the others, or their head may tilt one way or the other. That's all because of postural imbalances, and inside those imbalances, or in the midst of that imbalance, could be a subluxation in the spine. Now, in the next segment, we're going to talk about all the potential health problems that could be related to the subluxation of the spine, okay? But the first thing is to be aware of the fact that because we live in a world that is under physical stress, and we have no way to get around it because of gravity itself, there is it's impossible to not have an imbalance in the spine, okay? So stay tuned. We're going to talk about how the subluxations affect your overall health in the following segment.